A systemic review and meta-analysis of the prevalence of skeletal dysplasias at birth. The term skeletal dysplasia is referred to a heterogeneous group of rare disorders that have generalized abnormalities in bone and cartilage. A number of studies have estimated the prevalence rate at birth of skeletal dysplasias in different studies populations and settings. The objective of this systemic review and meta-analysis was to determine the overall prevalence of skeletal dysplasias at birth. Methodology. A systemic review was conducted in accordance with Prisma guidelines with no regional or language restrictions. PubMed was searched using mesh terms along with manual searching of reference lists for peer-reviewed articles published from January 1975 to August 2021. Random effects models were used to obtain the pooled estimates and to compare the rates in different study settings. The Prisma flow diagram is shown here. Results. After removing duplications, the search identified 677 unique articles. Predefined eligibility criteria were used to select articles. 37 full-text articles were assessed and 13 were eligible for this review. As you can see, this is the forest plot developed to summarize the results of the meta-analysis. A total of 12,754,418 births were included. As you can see, the inverse variance weighting was used to pool the studies considering the population size in each study. The overall prevalence rate of skeletal dysplasia at birth was 3.8 per 10,000 births. Then we categorize the studies into three subgroups according to their study setting. There were 5 hospital-based studies with a birth prevalence of 4.4 per 10,000 births. And there were 4 studies each in both multicentric and population-based studies having birth prevalence rates 3.1 and 3.9 per 10,000 births respectively. We didn't find any significant difference between these subgroups. Conclusions. Though larger multicentric and population-based studies showed relatively lower prevalence rates, they were comparable to the results of the hospital-based studies. The variability in considered pregnancy outcome and period of ascertainment used in each study is a limitation. These results provide a basis for policymaking and allocation of health resources in skeletal dysplasia care globally. Thank you.